Good day, everyone. Today I'm going to be talking about acid reflux and hiatal hernias. This is another one of those healthcare issues that I am extremely compassionate about, primarily due to the frequently seen negative healthcare consequences that are occurring from one of our most popular prescribed medications with all their negative side effects, or should I say effects, that they're having on Americans' health. I'm referring to one of the most abusive treatment protocols concerning our overall quality of health. Antacids, or what is known as protein pump inhibitors, or PPIs. Why? Because today's standard of care is treating with antacid and these PPIs with names like Prevacid, Nexium, the purple pill, and Rolaids and Tums. These are addressing the complete wrong biochemistry of our bodies. So, that given, these protocols are never going to treat the cause of acid reflux and the consequence of hiatal hernias. Again, why? Because the symptoms of acid reflux and the resulting hiatal hernia are caused not by an over acidic stomach, but actually the stomach has become too alkaline. So to treat these symptoms by reducing even more acid production, well, in my opinion, that's an oxymoron. Because you see, these antacids and these protein pump inhibitors, they're designed to neutralize the one thing the stomach is designed to do: make an acidic environment, release hydrochloric acid, or what's known as HCl. This is why once you start a prescription of over-the-counter antacids, they are very difficult to stop cold turkey due to what is known as acid rebound. So in a sense, these pharmaceuticals, they have your business for life, along with the undesirable side effects that follow. Side effects like anemia, muscle cramps, restless leg syndrome. You know, you go to bed and you kick around like a fish out of water. Irregular heartbeat and increased blood pressure. And other problems that are associated with protein and mineral deficiency. How about calcium? If we're not assimilating the calcium, we're more likely to develop osteopenia type conditions. Unless, of course, we seek out a treatment that corrects the cause of the acid reflux and the hiatal hernia, which is almost always going to be associated with low HCl levels in the stomach and inadequate digestive enzymes. Let me see if I can present this in chart form for just a second. Now, bear with me, excuse me, I had to perform this chart myself because my 3-year-old Audrey, her schedule was booked at the time. I believe she said she had to rearrange her LOL dolls. So, if you will, excuse my very simple explanation on the chart that follows. So once again, forgive me for my seriously simple version. This here is an example of a normal stomach, and this one is a stomach that is compromised with lack of stomach acid and proper digestive enzymes. Now this one's slightly larger. That's because, my scales are, well, okay. I'm trying to emphasize more of the negative approach happening over here. But I want you to look at this one. Here's your diaphragm, and here's the stomach as we normally see it, with adequate HCl levels. Notice the height here. Say about 2/3 plus of the stomach. And then, of course, the stomach's here, and then from here we drop into the stomach into the small intestines. So think of the stomach sort of like a reservoir, that it actually sits, okay, it's a holding tank that sits outside of the body, which starts into the small intestines. So the job here is to anything that comes inside here, it's going to hold it for a while, digest the contents before it lets it escape into the small intestine, and breaks down the minerals, the vitamins, the nutrients, and also, helps to kill off bacteria that it doesn't want to get into our the small intestine. So here's what happens when we don't have enough of the enzymes. So we take in food, protein, carbohydrates, and because of the content in the stomach, the protein is much more difficult to break down. Well, if we don't have adequate enzymes in the stomach to break down these proteins, it's going to hold the contents in the stomach, and this is going to create a condition where the simple carbs, like the processed carbohydrates, these are going to break down much faster. And when this happens, they're going to create a gas in here, and this is the bloating. And this bloating, when this occurs, it's going to literally, just like you would pressure, and that, of course, brings that pressure that you feel right up in this area here, which is usually where these hiatal hernias are. This is where these hiatal hernias will start. And for a lot of people, they'll have pressure when they're eating, and they feel like everything gets stuck here. Well, that's because this gas is causing the esophagus itself, the stomach, to push through the esophagus. And then we wind up with this balloon, which is your hiatal hernia, which is what you feel here. So when you try to consume the food, it feels like it gets stuck right here. And for people, mild hernias are not so bad, but seriously, rather large, uncomfortable hernias, you people know what I'm talking about. This is where you may go to bed, wake up in the middle of the night, and chest pain into your arms. And of course, you're thinking your heart. So you may even run to the emergency room. Trust me, it's happened to my patients many a time. And of course, they don't find anything wrong with the heart, run the EKG, every test, everything seems to be okay. So they send you for a stress test. And then, next thing, you have a meeting with a cardiologist, everything comes out normal. And of course, they don't diagnose the hiatal hernia. So you're confused as to what this is. And I've had some patients who literally have difficulty holding water down. It can be that difficult. So the key here is to decrease this bloating. A lot of times with people, they'll just feel like when they eat, they become stressed and they can't get the food past here. So they stop consuming the meal. Bringing these acid levels back up, how do we do that? Well, I don't mean to oversimplify, but it's sort of like I write in my first book, a simple guide. This is a case of consuming digestive enzymes in tablet form with hydrochloric acid. This will eventually correct this, bring you back to here, and symptoms abate. If not, we're going to talk about it a little bit later on. We mentioned some of the side effects of this and the problems that are associated with if we stay in this type of situation here with the low levels of the HCl, pressure upon the diaphragm. And I mentioned this, again, I keep going back to my book, Light Your Fire. This is a issue, condition, I don't even want to call it a disease, that is associated with our generation. This was really not heard of 50 years ago. As a matter of fact, back then, most physicians, if you went in with an acidic problem, they might give you a mild antacid, and then they would say, okay, hey, you got 2 weeks to correct this problem. Very seldom did you get a prescription that lasted longer than that. Today, once they put you on this, very often it's very difficult to come off of, like I talked about earlier, acid rebound. And when you tell a patient, well, we're going to try to take you off of that, oh no, I tried that, it was horrible. It is, until you correct the problem. So when we have a problem resulting from a metabolic issue, then we correct the metabolic problem. That's the only way that we're going to find a cure. There's no drug that cures a metabolic problem. So find the answer to that, and that's what this is: digestive enzymes, each meal with HCl, hydrochloric acid. This will, over time, bring your levels back up to where they should be and where they were in your youth, which is what we're after, okay? So let's move on. Hopefully this diagram is comprehensive. And again, due to lack of my 3-year-old able to do the work for me, well, this is what you get. Hope it's adequate. Another thing I wanted to touch on here, when I talk about the fact that this is sort of a disease of our generation. If you go back to your grandmother's day, when they brought food home, they consumed that food. Otherwise, it went bad. Same thing, vegetables, you bring them home, they have enzymes in them, so therefore you consume them or else you have to throw them out. Well, 50 years ago, that's the way it was with bread. You brought bread home, for example, it had enzymes in it. You ate it rather quickly or else it went rancid and it was uncomfortable to eat, and so you had to throw it out. Well, times have changed now. Corporate America, now bread sits on a shelf sometimes for weeks on end. You bring it home and again it still lasts a couple weeks. Why? Well, when they pull the enzymes out of food, I term it dead food. It can sit on a shelf for weeks at a time. With bread, they pulled the nutrients out of the bread. They pulled the B vitamins out of the bread so that it would not go rancid on the shelf. Now, then they'll fortify it with what they call fortified bread, which is to spray a synthetic B1 or B2 in the bread, which the body doesn't recognize anyway and wonders what the heck this is. And so therefore, this is how bread can actually leach the rest of your B vitamins out of the body. Look at example pasta today. Now it just comes in a box. The pasta of today, boll weevils won't even touch it. They put it in warehouses without the plastic around the pasta anymore. They used to do that 20 years ago. So now it's just in a box. You know why? Mice, rats, whatever, they're not touching it either. But they'll feed it to us. And also when you think about, let's go back to your grandmother's days again. See, back then, they used to use apple cider vinegar sometimes before a meal to prevent any irritation from that particular food if their stomach was a little too alkaline. And so therefore they would drop the apple cider vinegar in there and increase the acidity so that they could offset the complications associated with that. So that's how smart they were. So keep that in mind. Don't let your grandmother outsmart you now. Okay, Joey, then, so what do we do, right? Well, my treatment protocol is designed to specifically restore the stomach acid back to its youthful levels, as it was before the consumption of our acid-reducing foods and our acid-reducing lifestyles. Foods like processed carbohydrates, high fructose corn syrup, sodas, alcohol, tobacco products, and over-the-counter antacids. And sadly, medications like antidepressants. And we all know those are extremely on the rise, especially since COVID. But the list goes on and on and on and on. So the reality is this: because most acid reflux and hiatal hernias are man-made due to our diet and our lifestyle related issues, it makes sense that it would be totally correctable in the majority of the cases when the correct physiological approach to a physiological problem is implemented, period. Learn more about this correctable problem on my website, www.drjoeyjones.com, or in my recent book, Light Your Fire. Let me go over the side effects of these protein pump inhibitors, antacids, restless leg syndrome, and going to bed kicking around like a fish out of water. leg cramps in the calves, typically worse at night. Anemia. If you can't break down minerals, how are you going to break down metals like iron? Kidney disease and kidney cancer is even linked to these drugs. Irregular heartbeats. The heart rhythm is controlled by minerals, potassium, magnesium, just to name a few. And then again, increased blood pressure. And other symptoms that are associated with these minerals. And also deficiencies in protein as well, especially in the elderly. If we don't have enough digestive enzymes, the key with that is for the elderly is not only to consume the protein, but then they have to assimilate the protein, which is why a lot of elderly people may eat enough food, but yet they're still becoming emancipated because they're not utilizing the food that they're consuming. Especially true if they don't have enough digestive enzymes to break down that protein for utilization. So, if you're not sure if I'm spot on here, just Google the side effects of these drugs and see how many of them have creeped into your life. And for those of you who have my book, Light Your Fire, read pages 53 through 57 and learn more. And sadly, these symptoms are showing up in my clinic at earlier and earlier ages. And at earlier, or should I say much more frequency than they were when I first got out of practice 30 years ago. I've had patients when I was in Memphis, Tennessee, a woman who used to fly to Memphis from Chicago to have me push in her hiatal hernia to reverse her hiatal hernia for her. I have had patients come 2-3 hours across state lines to have this done. The truth is today, it's not uncommon to perform this gentle procedure on hiatal hernia reversals approximately once per hour some days. Now, this gentle procedure of reversing hiatal hernias, you can view this on my website, let me slow down, drjoeyjones.com. This hiatal hernia reversal procedure usually takes about 1 minute to perform. This one class of drug is probably responsible for more additional medication prescriptions due to their downstream side effects, or should I say effects, than any other medication that most Americans are prescribed today. As you can probably tell by now, I am very passionate about these types of medications. They have such a negative effect on our quality of life. Anytime I'm discussing a drug that attempts to alter our body's own natural, thousands of year old physiological function, I get a little agitated because this man-made approach is simply not how it works. And it's not how our bodies work. Physiology is physiology. Has always been since the beginning, always will be in the end. Mankind and modern medicine don't mess with our body's physiology. It was around long before you were, and it will still be here long after you're gone. Because that's just the way it has always worked best. Because it's how our bodies work best. So let me finish in closing with contact me on my website or on my email so we can get to work on correcting your condition if this is something that you've been struggling with. And see about getting off these medications with the help of your physician if they will, or even if they won't. So you can contact me from anywhere in the United States. Heck, you can contact me from any country these days via social media. My lines are open for you. I'm already treating people all across the country: Colorado, Chicago, South Carolina, Mississippi, Georgia, Florida. Today, just contact the clinic, fill out some necessary paperwork, and we can work on diagnosing, working up a treatment protocol for you, and get your world turned back into a healthier place. You know, going back to my book for a minute, I talk about how in today's world, the average 40-year-old's on 4 medications. The average 60-year-old's on 6, and for the most part, the average 70-year-old's on 7, sadly. But what you won't find, and I challenge you to find a 90-year-old on 9. It's just, they're not here anymore. So think about that, where you are in your total med consumption in your life at this time. The average 90-year-old may be a water pill, something simple like that. My grandmother, she lived 90 plus, and the only medication she took was a mild water pill. For her hypothetical, if you read in my book, you'll know what I'm talking about. Blood pressure. So it's time to start thinking about what's going on here. The new normal is sadly pretty scary. But remember, we're talking metabolic problems. And metabolic problems such as acid reflux and hiatal hernia, they're lifestyle and diet related, so therefore they're reversible if you have the knowledge. And because most of the time this is going to be in nutrition and supplementation, it falls outside the box of modern medicine. So if they weren't taught it, sadly, they're not going to be able to present you with that answer. So it's us doctors that are cutting edge, outside the box, if you will. We're a new breed, and we're out there. You have to search for us. The establishment would rather we fade off into the shadows, but that's not going to happen. So that's all I've got to say for now. But I want to end with thanks for hearing me out. And just let me say it again. Have yourself a great day, so you're not missing one. Until next time, Dr. J, have yourself that great day.